I really think we do need to be educating ourselves. It doesn't end when we clock off work. The first thing I'll say is when a woman presents, especially a black woman, when she presents as, let's start with pregnancy, she brings her whole self. She brings her body, her soul, and her spirit. For a lot of Black African and Black Caribbean communities, words are spirit and life. So I've left my home and I'm carrying another tripart being, spirit, soul, body. I've walked into your office and you're spewing a load of negativity. Now, those words are going to the ether, and there are many beliefs that they are not good for me. So I will reject them in terms of their effect. And you may hear that, and this is where I think, when I was in the NHS, people would say, they would write things like patient in denial, whereas all they're doing is expressing their desire for this bundle that they're carrying, particularly when we think about the lens through which health is looked at as Black people. My research showed that when we think about health as Black people, we're not just thinking about our body, we're thinking about our soul and our spirit. We're also thinking about what we call cultural memory. So we remember what we've been told, the stories of our antecedents. We remember the things that we're told to be careful of, and they may be fact or fiction, but one of them is language. So women are looking for somebody that they can trust, particularly in the African community, barrenness or unfruitfulness or not being able to have children is such a negative thing. The word woman, a man with a womb. If I have a womb as a woman, it's got to be used to carry babies. And in a lot of situations already, there has been difficulty getting pregnant. So now I've got this, finally, after several miscarriages or polycystic ovaries and all of that, I've got this pregnancy, and I walk into this room and the first thing you're telling me is all of this negative stuff. And I think there's something about understanding the lens through which people are looking at thinking about their health, protecting this pregnancy, and the way that it's communicated. A lot of Black African and Black Caribbean communities, their use of English is what we call high context. It's very nuanced. So even the way you're sitting and you're telling me about diabetes, already I'm giving you bombastic side eye and saying, in my mind, minus me. You're saying, these risks. I'm saying minus me. I'm rejecting the bad news, but I do want to hear what I need to do. So what a lot of women are looking for is an ally. Tell me the truth, but allow me to inject my beliefs. The other thing that we noticed, we did some work in Lewisham, Black African and Black Caribbean women, and they said that there was a pressure on them to be the strong Black woman. And this pressure came from the elder women. So if I think about my generation, I'm 50-something, and my daughter is 30, and I've got a son who's 30-something. Their generation, what they think of my generation is, stop calling us strong Black women. You're enforcing us. So one of the things is you're a strong Black woman. If they say this baby's going to be too big, that's good, because big babies are good. That means they'll be strong. If they say cesarean, tell them you reject it. No cesarean. You're strong enough to push that baby out. So there's something about understanding. The only way to understand is to come with that culturally humble posture and ask questions. How do you see health? Doing our homework, as was mentioned earlier, understanding some of the beliefs and cultures and asking questions, being curious and showing that you care.
Thank you, Shola.